hope y'all are hearing me tonight. We're with all the rain outside and everything. I hope it's not affecting our connections. In any case, I'm so glad you're here today. Today, we're going to talk about how gum disease impacts your overall health. We tend to think in terms of gum disease as something that's just limited to the oral cavity. And that really couldn't be further from the truth. I'm also looking at chat. So if you have questions as I'm going through this presentation today, put them in the chat and I'll try to respond to them as I can. Anyway, so it turns out, the bone in your mouth, it's porous and there's lots of blood vessels in it. And the infection in your mouth can impact the other parts of your body. And so it does have a lot of health implications. Let me see if I can start flipping these slides. So today I'm also going to talk about laser treatment as well as the impacts of gum disease on your health. And I like to show my staff and let you know that we've been doing this for a long time. I think we got our first laser in 2000, October of 2000. And we started using that to treat gum disease because it's minimally invasive. But over that same amount of time, the research that's popped in to describe how gum disease is impacting your health has grown dramatically. So, for example, 20 years ago, we knew that gum disease caused more inflammation throughout the body. But now we can tell you unequivocally that if you have active gum disease and you have increased risk for heart attack or stroke, your gum disease makes that worse. And I'll talk to you about that as we go on. Same thing for diabetes. Did you know that a patient that has diabetes, that has gum disease, the gum disease typically raises their blood sugar by 20 to 30 points just by having the gum disease. And that's important because once we treat the gum disease, sometimes patients on diabetic medications need to modify their medication because the overall blood glucose will go down as the gum disease is eradicated. Arthritis. Oh my gosh. Gum disease and arthritis are really well documented. And so patients that have active gum disease typically have more active problems with their arthritis too. And a complicating factor of that today, a lot of patients are taking these biologics that suppress the immune system, which allow their gum disease to take off uncontrollably, which can actually make your body attack your joints more, meaning you have to have more biologic. So it's a cycle. It's an issue that has to go on. So we're going to discuss that a little bit more today. So gum disease is really common. The American Dental Association says about 80% of the adult population in the United States has some level of gum disease. And about 40% of that same population has gum disease to the extent where they have bone loss around their teeth. So by gum disease, I mean an infection in the gums. So that can just be bleeding. If you brush your teeth and there's any blood in the sink when you spit, well, you have some level of gum disease right there. And gum disease doesn't typically hurt. And so not until it gets into the last stages. So I've had lots of patients tell me, well, yes, I get a little bleeding when I brush every once in a while, but it's not much and nothing hurts. And I don't feel anything. You're not typically going to feel anything until the bone loss is all the way to the tip of the root, in which case you either lose the tooth or have to have root canal, stuff like that. So gum disease is more of a silent problem, and it has to be managed just like patients with diabetes manage their diabetes. You have to manage gum disease much the same way. It's not like you really cure gum disease. We just control it. Same thing with diabetes. This was an interesting finding too. This was another ADA report. And it's just showing you the level of prevalence in the southern U.S. And it's around 50%, just a point or two above or below. In the northern U.S., it's a little bit less. It's more like some of the northern states I know are around 45%. But it's still a very significant problem throughout the United States. So gum disease is really common. And what's funny is the same thing that has protected you your whole life is what is causing the problem now. So, for example, 15 minutes after you were born, you developed a microbial flora in your mouth. And that microbial flora was protective. You know, when foreign bacteria came into your mouth and tried to set up shop, so to speak, those foreign bacteria didn't have anywhere to land because your bacteria were coating all the surfaces inside your mouth. And even if they could land, they didn't have anything to eat because your host flora was eating all the available nutrients coming into your mouth. And so your natural flora was protective for a good part of your life. And then as we grow older, there starts to be some changes in our natural flora. And it can lead to, it can create an environment in which more pathogenic bacteria can all of a sudden start taking hold. And typically you start seeing patients that start having gum disease in their 40s. And then by the time they're in their 50s and 60s, that's when 60 to 80% of the population has some level of gum disease. So it's really common. Major health risk linked with gum disease. So heart disease and stroke. So these two diseases are primarily inflammatory diseases. And so when you have a gum disease in your mouth, it raises your C-reactive protein, which is a measure of your total body inflammation. So by raising your inflammation, think about this. So when you have plaques in your blood vessels, they're usually in the middle wall of your blood vessels. So you're in your coronary arteries. You typically don't have plaques just lining the vessels. Most of the plaques are in the interior, the middle layer of your arteries. And when you get gum disease, what happens is it creates inflammation in these blood vessels. And these plaques, they start getting foamy around the periphery because of this inflammation. And then as they get foamy, that's when they start leaking into the middle part of the arteries, or that causes a heart attack and stroke. And so gum disease is directly implicated with making these plaques in your blood vessels more active because it inflames them and causes them to start expanding. Diabetes. So I was telling you earlier that diabetes is gum disease typically makes somebody's or gum disease makes their diabetes pop up 10 to 20 milligrams per deciliter. So if you're taking your blood glucose every day and you poke your thumb, or if you're wearing one of those monitors and you have controlled diabetes, but you have active gum disease, if we treat the gum disease, your overall blood glucose is going to go down because the inflammation from your gum disease was artificially kicking up your blood glucose. So it makes it worse. And that's a major factor because lots of patients are taking multiple drugs to control their diabetes. And what's interesting too about diabetes is it actually promotes gum disease. So it's a vicious cycle in this disease as well. When you're a diabetic, you're predisposed to develop blood clots. And these blood clots, so say that you have an infection around your teeth and it makes your gums bleed. Well, normally, if you didn't have diabetes, your immune system would come and clear those blood clots away. But when you're a diabetic, your body doesn't clear away those blood clots underneath the gum. And now they serve as a food source for bacteria. So we were talking about, or I was talking about just a minute ago, how your flora can change with time. So if you have diabetes and these clots start forming underneath your gums, those clots your normal flora doesn't eat that. That's not their food source, but it is the food source for lots of pathogenic bacteria. And so also the pathogenic bacteria really don't like oxygen. They prefer your CO2. So now you've got a food source underneath the gum. These bacteria move underneath the gum and start growing, and they like it there because there's no oxygen. It's more CO2. So diabetes really creates an environment that promotes gum disease. Respiratory disease. So most of the infections that cause gum disease are also the same infections that you get when you have chronic sinusitis. So if you're stuffy all the time, you know, the about a quarter of the population in Houston has a chronic sinus infection. The ENTs can't clear it. The medications you take don't clear it. And so this bacteria, this low-grade infection persists in the sinus cavity over time. And it's the same bacteria that tend to persist that cause gum disease as well. So you've got this two infections that tend to go back and forth. And when you lay down at night and sleep, you have drainage, and that's when you start to swallow some of these bacteria and they get into your lungs. So COPD, which is a chronic inflammation of the lungs, you know, your lungs don't expand like they used to. A lot of that's from this infection from the oral cavity or from your sinuses that are dripping down into your lungs, creating a chronic inflammation, which leads to scarring of the lungs, which prevents them from being as flexible as they used to be, resilient as they used to be. So gum disease can make your COPD worse and can accelerate it. And on that same line of thinking, prostate disease, you know, 50% of all men have some level of prostate disease, where it's benign enlargement or something worse. And it's turned out that the inflammation from gum disease stimulates certain prostaglandins, or these inflammatory components that actually makes your prostate enlargement worse. So patients with gum disease that also have any type of prostate problems, the gum disease will accelerate the prostate problem. Osteoporosis. Tons of people are fighting with osteoporosis today. And gum disease, along these same things, it creates inflammation. The inflammation stimulates something called osteoclast, which are these cells in your bone that are supposed to regulate your bone. There's a cell that eats up the bone and another cell that comes behind it that lays down new bone. When you have more inflammation in the bone, you get a hyper reaction from these osteoclasts. So you have more osteoporosis. And we just spoke about arthritis. There's something called an Arthus reaction. And it's where bacteria from the oral cavity float around somewhere else in your body, and they land somewhere else in your body. So, and specifically, if they land in a joint, your immune system will detect these bacteria eventually and try to kill them with something called porphyrins. But when they do that, they damage the joints. So having inflammation from gum disease and then having the bacteria from gum disease can actually accelerate and make your arthritis worse. And we were just mentioned a moment ago about the prostate antigen levels, your PSA test. Patients with gum disease have higher PSA tests than patients without. And interestingly enough, too, when your gum disease is treated, your PSA score can go down as well. So same thing with diabetes again. When your gum disease is treated, your blood glucose levels tend to drop 10 to 20 milligrams per deciliter. This one's kind of interesting too. Gum disease they're starting to research gum disease impacts on cancer. And so the bacteria that cause gum disease have been found in colorectal cancers. We already know that gum disease increases inflammation in the body, but the bacteria are also pathogenic as well. And so once they're in the mouth, they develop this dynamic equilibrium. These bacteria just aren't localized to the oral cavity. They can get into your bloodstream because your bone in your mouth is very porous. There's lots of blood supply. And these bacteria can get into your blood supply and float to other places in your body. And it just so happens they've found the bacteria from gum disease in plaques in people's hearts after they've had heart attacks. And they found them in colorectal cancers as well. So the infection is just flat not good for you to have floating around in your body. And biofilms are kind of like, think of mucus. What a great thing to talk about at lunch, huh? But so a biofilm is this mucus-like layer. And when it's on your teeth, what happens is the bacteria grow on the surface of your teeth. They develop a plaque around them. And this plaque has a lot of mucus associated with it. And this mucinous layer actually protects the bacteria. So it's something the bacteria develop in order to withstand our immune system and our body's defenses better. And so as you develop this biofilm or this plaque in your mouth, this plaque protects stuff from penetrating through it to kill the bacteria. And it also creates an environment that allows the bacteria to grow faster and more. As this biofilm around your mouth develops, your immune system hates it. And so it'll start sending immune cells around trying to kill it, but they can't penetrate the biofilm. So what does it do? It starts destroying the tissue around the biofilm, and that creates inflammation. So I'm sure if you've had a physical in the last decade, one of the things that your physician looks at is your C-reactive protein, CRP. And that's a measure of total body inflammation. The studies have shown that if you have active gum disease, it elevates your CRP. Well, the CRP creates inflammation that raises your risk of heart attack, stroke, diabetes, benign prostate enlargement, all these other things. So they're all connected. This is what I was talking about in the beginning. So increased carotid artery intimal media thickness. So if you go to your physician and they want to determine if you're having a buildup of plaques, they might do an ultrasound in your neck or other parts of your body and look at your arteries to see if there's plaque buildup inside those arteries and veins, so mostly arteries. And the thickness of that middle layer is where the plaque starts. So the plaque starts in, think of your arteries as a hose, and the hose has multiple layers to it. That middle layer is where the plaque starts developing. And then as the immune system is inflamed by your gum disease, it causes that plaque in that middle layer to become foamy and to start leaking into the main portion of the artery. So CRP is really an interesting finding or interesting thing to watch. And it does reverse when your gum disease is treated. So you treat your gum disease, your total body inflammation drops within about 2 weeks. So this came out from a joint conference between the periodontist and a cardiac meeting that was held about, I want to say it's about 10 years ago now. And that if patients have gum disease, they need to be told that they have an increased risk for plaques in their blood vessels and up to a 3 times greater risk for having a heart attack or stroke, and about a 1.5 to 2 times greater risk of having a fatal heart attack or stroke. And that's kind of what this one is showing too. 1.5 to 2 times greater risk of a fatal cardiac event. COPD, 1.5 times greater with gum disease than without it. And this one was not one you would necessarily anticipate with gum disease, but it turns out when mothers are pregnant, they start producing a lot of a hormone called progesterone. And there's a bacteria called Bacteroides intermedius. And it is like when your progesterone goes up, it's like this particular bacteria starts growing massively out of control. And it creates gingivitis in a pregnant woman. It's that gingivitis starts causing these the production of these prostaglandins, or this inflammatory component that will actually cause the baby to be born prematurely. And so for pregnant mothers, if they have any signs of inflammation around their gums, they need to have their teeth cleaned. That typically you want to do it in the middle trimester. So when the baby's brain's developing in the first trimester, we don't really want to do any type of dental treatment, period, especially gum disease treatment. But in the middle trimester, the brain and the brainstem have developed, and that's the most stable time to have any type of gum treatment, is in the middle trimester. And you want to have it then because it may prevent preterm low birth weight babies. In the third trimester, well, again, we can't really treat patients with gum disease in their third trimester, because just treating the gum disease could cause a release of prostaglandins that causes premature birth. So something to think about. If you know someone who's pregnant, if they're having any type of dental or gum problems, they need to address them in the middle trimester. So there's different levels of gum disease, and gingivitis is just when the gums are starting to become inflamed. So they don't hurt, but the bacteria is building up around the teeth. And as that bacteria builds up, it creates inflammation that raises your C-reactive protein. As gum disease progresses, you start to have bone loss around the teeth. So as the bacteria grow down the surface or the root of that tooth, the body's immune system goes nuts. It tries to kill the bacteria, but it can't really get to the bacteria because of this biofilm that we were discussing earlier. And so not only do the bacteria cause bone loss, but your immune system will accelerate the bone loss because it's frustrated it can't kill the bacteria. So you start developing bone loss, and this bone loss creates a void underneath the gum where even more bacteria can live. And then it just progresses over time to create more bone loss and more bone loss, creating a bigger environment for more infection. So when we treat gum disease, our goal is to prevent any loss of your natural anatomy, which is a pretty big change from the past. You know, in the past, osseous surgery meant you make incisions with a scalpel, you reflect the gum back, you scrape out all the infection, you kind of round off the bone, and you suture everything back, and the patient ends up with recession after an event like that. Today, we do everything with lasers, and the lasers are minimally invasive. And so with a minimally invasive incision, it prevents swelling. And so the lasers actually seal off in the blood vessels and lymphatics when you're using them, and that prevents swelling. Swelling prevents further inflammation. And because there's no swelling of the tissue after the surgery, there's less pain or no pain most of the time associated with laser gum treatment. Laser incisions also make it where I can see what I'm doing. So when I first got into practice 30 years ago, our goal was to do minimally invasive surgery. Even back then, there were studies coming out of San Antonio, University of Texas at San Antonio, that were showing that minimally invasive surgery resulted in faster healing. And if you were doing regeneration or bone growth, you got almost twice as much bone growth from a minimally invasive procedure as you did from an open flap procedure. And so the problem was when we were trying to do surgery back then, we were using ophthalmic instrumentation, a really tiny instrumentation. But the moment you made an incision, it would kind of bleed in there and you couldn't see what you're doing very well. And then along came these lasers. The lasers were really great because they sealed off the blood supply as it made a minimally invasive incision, and that made it where we could see what we were doing. So that's kind of a real key component, is not only being able to get rid of the infection, but being able to see what you're doing allows you to do a better job. We use different types of lasers in our office, both diodes and erbiums. One of the cool things about these lasers, in many cases, we can use them with just topical anesthetic. So for example, a patient comes back and for a recall appointment, they've been treated for their gum disease and they're coming back every few months to have their teeth just a regular cleaning. If we start to see an area break down, rather than wait for that area to get bad enough that you have to have surgery again, most of the time in the office, what we'll do is we'll use a paintbrush with some topical anesthetic. You paint that in the area you want to do it and use a laser to treat that and zip that pocket back up at the time of a cleaning. I mean, it's just so easy. It's so quick. And it happens during your cleaning in about under 2 minutes. So it's a pretty cool thing to do. And it really kind of changed the dynamic. Typically with a traditional osseous surgery, you'd have flap surgery, and then the periodontist would tell you to come back every 3 months for a cleaning. And then in 3 to 5 years, those areas would start breaking down again. And so your dentist would wait for those areas to get bad enough that you need surgery again. And so you would have, but at the time of as the bone loss progressed, you would typically lose 1 or 2 of your molars. And then the osseous surgery would be repeated, and you might lose another molar. And then another 3 to 5 years passes, and you lose even more teeth, and you have more recession with each treatment. With lasers, that has all been kind of reversed. At the recall appointment, we can use a laser to reverse the gum disease in under a 2-minute procedure. And 2, it doesn't cause the recession or the sensitivity that a traditional surgeries cause. So, and it's also been shown that the bacteria that cause gum disease. So I was telling you about bacteremias earlier. So with traditional gum disease, if you have someone make an incision in your gums, these bacteria actually have access to your blood supply at that point, and it can create a bacteremia. And so if you've got artificial joints, or you have, so you say that you have a knee replacement, or you have stents in your heart, or valve replacement, that's a concern because the bacteremia, this bacteria in your blood, can actually land on some of that stuff that you don't want it to land on. Whereas when you're using a laser to clean out these infections, the infection's vaporized, and the blood supply is sealed, preventing the bacteremia. So it's just a better way to go about it. Other things that the lasers have benefits with are, we do a lot of procedures called regeneration, where we're regrowing the bone and the gums back around your teeth. And it turns out that when you use a laser on the surface of a tooth or an implant, it makes the gum cells, your bone and your gum cells, adhere and attach to your teeth better than if you were using solid instrumentation. So it's another benefit of lasers. Cosmetic surgery. So if somebody has a gummy smile, we can recontour their smile with a laser, and what you see is what you get. With traditional type of surgeries, you typically have to wait a month because the gums would shrink up a little bit, and then you'd have to have a revision surgery. Then you'd wait another month, and then you'd finally get your veneers, or you'd have your final result. With lasers, what you see is what you get right when the surgery's over. It's a huge benefit. And kind of a final thought, lots of patients avoid gum treatment because they know someone who's been through a terrible experience. That is just so common. Even dentists, I treat lots of dentists in my practice. And I can tell you that dentists know all about it, but they dread having it done just like you do. Whereas with laser procedures, because there's no swelling, then that prevents pain. You don't have the discomfort and the recession associated with traditional therapy. So just another benefit. Anyway, our next presentation I'll do in a month, we're going to talk more about nutrition. What can you do to improve your healing? What things do we recommend? What things can you do that actually makes your regeneration better, your healing faster, that type of thing? I've got a question here that says, since gum disease is related to a major health risk, can you explain why Medicare doesn't cover some of the treatment? I can't really. When you look at what Medicare does cover as far as dentistry goes, it generally covers extractions and dentures. It doesn't really cover much of anything else. And you can buy supplemental policies, but even the supplemental policies, I haven't seen a lot of policies that do much more than extractions and dentures. That's something to take up with the political leaders, because right now Medicare, Medicaid even doesn't really cover these types of treatments. Doesn't cover gum treatment really very well one way or another. Anyway, thank you so much for attending today. We'll do another one in a month. I hope you have a good day. Bye-bye.